They're common enough at one point or another. We've all experienced a headache, but for some, these can be debilitating, especially when turning into something else altogether, migraines. Let's welcome Dr. Habib Rizk, Associate Professor of Otolaryngology at MUSC. Did I say that correctly?
Yes, you did.
Okay, very good. So maybe you could describe what that type of surgery is.
So otolaryngology, head and neck surgery, is a subspecialty that involves ear, nose, and throat. And I am specifically a neuro-otologist specialized in ear and skull-based disorders.
Okay. And when we're talking about headaches, we've all experienced them. It's inevitable and it's unavoidable, quite frankly. What is the main cause of someone who either experiences headaches on a regular basis or chronically?
So headaches can have many causes. 50% of the population will have a headache at some point in their life, but about 15% of the US population will develop a migraine headache at some point in their life. And specifically for migraine headaches, it's usually, there's a component of genetic predisposition, but also environmental factors that can lead into that migraine response.
Yeah, and so what would be some of those factors? And when you're experiencing migraine, for someone who's never had one before, how would you describe it?
So a typical migraine headache is a headache that is severe in intensity, that stops you from doing your activity. It doesn't mean necessarily you need to lay down and lose a day. It could still be bad enough that you can continue working. It's also associated with other factors, including sensitivity to light and sound. These are the more classical ones. And in the most classical form, it comes with visual auras. These are prodromes. These are warning signs that you're about to get a headache that most people start recognizing. Flashing points in their vision, blurry vision, dark spots in their vision, announcing the headache.
And it can also manifest in nausea and other...
Correct. Correct, and there's a lot of atypical forms, and these are the forms that I personally see the most in my clinic.
I see. And it's important to distinct a headache from a migraine because the two are not the same.
Correct. A migraine is more than just a headache. That's kind of the tagline that people who see migraine want people to know about.
Sure, so it's not just as easy as popping in an aspirin and it'll be gone in a few minutes.
Correct.
Let's talk about vestibular migraines. Now these are they rare? They're not your typical garden variety migraine.
They are not, but they have been found to be in recent years one of the most frequent causes of dizziness that present into our office.
Oh.
And we did a recent epidemiological study in collaboration with colleagues from UC San Francisco that showed that the epidemiology of vestibular migraine in the US is about 2.7% of adults, which is about 9 million people.
That's a lot. That's a lot of people.
That is a lot, but only 10% of those people are diagnosed with vestibular migraine.
So people just think that, oh, it's something that comes and goes and it'll go away and I'll be fine the rest of the time. They don't actually, could there ever be long-lasting effects from constantly suffering from these types of migraines, the vestibular type?
So this is a benign disorder in the sense that it doesn't cause, fatal, outcomes, but it can have debilitating effects on productivity, on personal and professional life. And it is, quite frankly, people who have the severe form are miserable.
Yeah, I can only imagine. What's the best way to treat these migraines?
Well, the first thing is to actually recognize it and diagnose it. The problem is not from the patients usually shrugging it off. It's usually from the medical community not recognizing the symptoms and treating it as something else or discarding the symptoms. We've done another study that showed that the healthcare burden of vestibular migraine is in the billions of dollars per year.
Oh, wow. Would you say that people can change their diets, that they can incorporate other things into their daily activity to at least mitigate ever experiencing these migraines?
Correct. I mean, like migraine headaches, lifestyle modifications are extremely important. It starts with dietary restrictions, and every person has different dietary triggers, and they have to do the work to recognize what are their triggers. Exercise and isometric exercise, cardiovascular exercise 3 times a week is also very helpful. Anything that is heart health related would be helpful.
Absolutely.
But in some cases this is not enough. and you need to proceed with what we call preventive medications. And these are exactly the same as what we use for migraine headaches. They are usually medications used for other things, antidepressants, anti-seizure medications, blood pressure medications, repurposed to treat the migraine pathology.
I see. Well, anybody who's listening to this and they know that they suffer from these types of migraines, they know exactly who to call. Thank you so much, Dr. Rizk. I appreciate your time.
Thank you for the invite.
We're back after this.